So the whole concept of BRCA mutation 1 or 2 at this point in time is based on germ-line mutation. And this trial was like the POLO trial, worked on the germ-line mutation in patients with BRCA1 or 2 mutations. And in this trial was started a while back, so at that point in time, we were again believing that this use of platinum compound is beneficial in patients who have BRCA1 or 2 mutations, and therefore gemcitabine and cisplatin was used as a regimen to treat those patients. Now, it's not a standard regimen we use in patients with pancreatic cancer, but nevertheless, I don't have any difficulty in seeing that regimen used in this subgroup of patients who are vulnerable to platinum hit. So that was the platform which was used to test the role of veliparib. The trial gives us at least 2 or 3 points that we have to keep in mind. One of them is that gemcitabine cisplatin appears to be active because the survival was longer than what we see on average in a frontline setting in patients who have either gemcitabine, nab-paclitaxel, or FOLFIRINOX. So it really goes along what we knew before, that a platinum-containing regimen such as cisplatin, when used in those patients, we see a longer survival as a result of a better response to treatment and longer progression-free survival. The second point is a negative one, veliparib. It didn't add to the combination. Well, again, it's not surprising at all because, number one, veliparib is less potent as a PARP inhibitor than olaparib. It's one of the earlier generations of the compound. Concept of PARP inhibition is not as good as olaparib as a molecule. And second, generally speaking, we shouldn't be really combining PARP inhibitors with chemotherapy because it just increases the toxicity of the regimen. So this study was good when it was written as a study to be done. Now, some of the things we get from it are some things which we already probably knew. Number one, the combination will be more toxic, and number two, platinum compounds work in this setting, and we already knew that, and we've been doing that. But it's a nice trial to really add to our knowledge in this field. Now, based on what I saw yesterday, the investigators are going to look at more molecular markers, so we might end up learning more about associations between some additional molecular markers, mostly related to DNA repair space, and how that might relate to outcome of treatment.